When most people think about knee replacement surgery, they imagine the surgery itself, the operating room, the sterile lights, the moment everything changes. But the real questions come the next morning. How am I going to feel? Will I be in pain? Can I walk? Did I make the right choice? I'm Dr. Tyler Goldberg, an orthopedic surgeon specializing in concierge hip and knee replacement. For the last 25 years and 12,000 surgeries, I've seen patients literally transform physically and mentally. I'm on a mission to transform the way the world experiences joint replacement. And I've guided thousands of patients through this exact moment, those first 24 hours after knee replacement surgery. Ready? Let's hit it. Today, I want to help you understand what's normal, what's not, and what to expect from the minute you wake up after surgery through your very first full day of recovery. Because when you know what's coming, you can face it with clear confidence instead of fear. The day of surgery, day 0. When you wake up after surgery, your first thought will likely be, okay, it's done. Now what? That's completely normal. You'll still be feeling the effects of anesthesia, maybe a little groggy, a little foggy, and your leg will feel different, heavier, tighter, probably numb. That's because you have all the local anesthetic and nerve blocks working to control the pain. In fact, most patients tell me the first few hours after surgery aren't painful at all. They in fact have no pain. You'll feel pressure, but not pain. Some patients have pain when they wake up and have the local pain cocktails set in during that time. It's okay. We have really great pain meds to ease any early pain if you have it. So after you wake up, our team will get you moving. Yes, that very same day within just a few short hours of surgery. We'll have you sitting up, standing, and even taking your first steps with assistance. That early movement is crucial. It reduces the risk of complications, keeps your circulation strong, and starts retraining your muscles. There's an added benefit in that it will distribute the pain cocktail around your knee. I've seen patients be in pain and literally watch the pain resolve from their face once they stand up and take a few steps. And yes, it's going to feel awkward. Your knee will be swollen, your leg might feel heavy, and you'll be thinking, there's no way I'm walking on this. But trust me, every step counts. That first movement is your turning point, the first night, sleep, swelling, and reality. That first night isn't usually easy, and that's okay. You might not sleep well. Between the medications, swelling, the hospital environment, and the sheer adrenaline of the day, your body is in overdrive. Many patients describe it like a hangover without the fun the night before. Expect swelling, stiffness, and a general sense of what just happened. That's all normal. You may also notice your appetite is off. That's from the anesthesia and the pain medicine. If food doesn't sound appealing, focus on staying hydrated. Even small sips help your recovery more than you think. And yes, a small amount of blood under the bandage or a light stain on your dressing is normal. But if your dressing becomes soaked, if the wound is leaking actively, or if there's increasing redness, that's a reason to call your doctor. If you're preparing for knee replacement, or maybe you're watching this from your recovery chair right now, drop a comment below and tell me how you're feeling. I'd love to hear your story and answer any questions you have directly. And if you're not sure whether surgery is right for you yet, take our free 2-minute joint pain quiz. It's a quick, helpful way to see if joint replacement might be the right next step for you. We're here to help you make confident, informed decisions about your care every step of the way, the morning after, day 1. Day 1 is when things really start to feel real. The nerve block begins to wear off, so you'll feel more sensation in your knee, and yes, some more pain. But remember this, pain doesn't mean something's wrong, it means your body is healing. We'll use multimodal pain management, meaning a combination of anti-inflammatories, nerve medications, and light opioids if needed. The goal isn't zero pain. It's manageable pain that lets you move, sleep, and participate in therapy. By day 1, your physical therapist will guide you through gentle range of motion exercises. That first bend is tough, but it's critical. You'll also start to practice standing, walking short distances, and learning how to safely get into and out of a bed or even a chair. It's normal to feel frustrated. Your knee might not feel normal. It might feel stiff and foreign. You'll look down and see the swelling and bruising, and it won't look like your leg yet. That's all a part of a process. It's normal. I always tell my patients, your knee you have now isn't the knee you're keeping, it's the one you're building. And every small movement you make is a step closer to getting your life back. What's normal versus what's not, red flags. Let's talk about what's not normal so you know when to reach out. These are the red flags we're looking for. Chest pain or shortness of breath, severe, sharp calf pain or swelling that's worsening, drainage that soaks your dressing, fevers or chills that don't improve, pain that's suddenly increasing instead of getting better. If you experience any of these, call your surgeon immediately. Otherwise, most of what you're feeling, the swelling, the soreness, the tightness, is your body doing its job. It's called healing. What you'll feel emotionally. The physical part is one thing, but emotionally, day one can hit hard. It's common to feel regret or doubt. You might wonder, did I make the right choice? You might even be frustrated with your spouse, your nurse, or even your surgeon. And guess what? That's normal too. This is one of the hardest days of recovery, but it's also about beginning transformation. Every single patient who's ever said, I wish I hadn't done this, also says weeks later, I can't believe how much better I feel. You're not failing, you're healing. Small wins and what comes next. Your first 24 hours are about endurance, not perfection. If you can get out of bed, stand up, take even a few steps, that's a huge success. Congratulations. You may feel exhausted, you may feel emotional, but by tomorrow, things will already start to improve. Swelling begins to stabilize, movement feels a bit easier, and your confidence starts to build. From there, recovery is all about steady progress. Each day, you'll get a little bit better, as long as you stay consistent and follow your plan. If you're in one of those few days after knee replacement, you've already done the hardest part. The surgery is behind you, the healing is ahead of you. And while the first 24 hours can feel overwhelming, remember this, it's temporary. Every day, your pain will lessen. Every week, your strength will grow. And before you know it, you'll be walking without pain, doing the things you love again. If you found this video helpful, subscribe for more clarity-driven insights on recovery and joint health. And if you want to take that next step in understanding your options, take our free joint pain quiz linked below. I'm Dr. Tyler Goldberg. Thanks for watching. And remember, this is the start of getting your life back.